Seems like a likable guy. I've met him once or twice. Very nice guy. But he's no conservative. I'm going to prove it to you. And by the way, he wants to be president. But then again, who doesn't? What with all the travel and golf and so forth. But I'm concerned, quite frankly, as a side point, that this field's getting loaded down. I can already think of about 20 who want to be president and run on the Republican side. And about 17 of them are, well, they're really lightweights. They're lightweights. So John Kasich is defending his massive expansion of Medicaid. And I heard the idiot senator from the Commonwealth of Virginia, Mark Warner, go on and on today about expanding Medicaid is important because otherwise people are going to walk into the emergency room and get free care. The idiot hasn't figured out that Medicaid is essentially free. It's welfare. And it's actually cheaper to have people walking into the emergency room and reimbursing that kind of care than it is giving them a whole host of medical coverage under Medicaid. But he's an idiot. He runs as a fiscal conservative. He pretends he's against Obama when he voted with Obama 97% of the time. But the people in Virginia, a.k.a. the people from Maryland and the District of Columbia who moved into Virginia, they want a Democrat. Hey, Democrat, vote Democrat, Democrat, Democrat. Meanwhile, they leave their states and they come into a perfectly good state and they screw up my state. Like locusts. They chew up their own farm, then they come on my farm. You get the point. Anyway, so here's John Kasich in Ohio, a pretend conservative, asked a question by Chris Wallace of Fox News. Cut 8, go.
On Obamacare, you declined setting up a state exchange, leaving that to the feds. On the other hand, you have agreed to accept the money to expand Medicaid over the objections of the majority, Republican majority in your state legislature. How do you explain those different actions?
Well, Chris, first of all, I don't think it was over the objection of the majority of Republicans.
Stop. Oh, yes, it was. You rammed it down their throats. You evaded the legislative process. I'm on to you, Kasich. I'm on to you. You're spinning like a liberal liar. Go ahead.
Had there been a vote, I think it would have passed.
Stop. Had there been a vote. Got that, folks? Because he imposed it, in essence. Had there been a vote, I think it would have passed. Well, why wasn't there a vote, pal? Go ahead.
It's entirely consistent with conservative and Republican philosophy, and I'm really pleased we're doing it because there are many people in Ohio now whose lives, frankly, will be in a position of being able to move forward.
Sounds like Obama. We're moving forward. Why? By expanding government. Oh, let's move forward and expand government. Understand, ladies and gentlemen, a massive number of people are now filing into Medicaid at the urging of the federal government and the radical left because they want us all on Medicaid one day, in essence. And they're doing this by redefining who qualifies for Medicaid. And what Obama has done is he said, okay, for the first 2 years, the feds will give you 100% reimbursement for these additional costs. So these governors, including about 6 or 8 Republican governors, they view this as found money because the real hit from Medicaid won't come until they're out of office. And then the federal government will say, you know what, we'll only pay 90%. Well, you know what, 70%. Today they pay 55% of the original Medicaid accounts. And that's what they'll get down to. So I'll give you an example, only because I'm familiar with my state, the Commonwealth of Virginia. They want to expand it to add over 400,000 people to Medicaid. What happens when the federal government massively reduces its subsidies? And by the way, folks, we pay the federal taxes and the state taxes, and so do you. They act like this is some damn game. Now, he said more than that. He says this is consistent entirely with conservative and Republican philosophy. He said, I have a chance to bring back, listen to this language, bring back $14 billion back to Ohio. Ladies and gentlemen, he's not bringing back $14 billion to Ohio. There is no $14 billion. He's creating a $14 billion expense that the federal taxpayer is going to have to pay, or your children and your grandchildren are going to have to pay. If he said no, there's no $14 billion, period. It's not like it's sitting there for every state to grab. He created the $14 billion expense. Kasich did. And then he goes, bring it back to Ohio to do what? To strengthen our local communities as they treat the most significant problem of drug addiction, the problem of mental illness. We must help people who live in the shadows. Is this guy for real? Oh, he's a conservative, perfectly conservative. I know this, just like Jeb Bush and Chris Christie. Chris Christie did the same damn thing. And the folks in New Jersey are going to pay a huge price for this one day, as hundreds of thousands of people now have been pushed into Medicaid who had private health care insurance. Yes, they did. And they're being pushed into Medicaid. And these guys are using this money to balance their budgets. It's the worst. If Kasich were in the private sector, he'd be serving time in the same cell with Madoff today.